Welcome back, everybody. WAJR's Ask the Expert, sponsored by HealthWorks Rehab and Fitness, continues now. Joined in studio by Travis Rummel, who is the clinical director of the Smithfield, Pennsylvania HealthWorks location, and orthopedic surgeon Dr. Nick Zervos. We're talking about foot and ankle pain. In our first segment, we talked about chronic foot pain that just kind of shows up one day, and it's a lingering, constant, chronic pain. But then we've got foot injuries, guys, and ankle injuries that we know exactly when it happens. When we step out of a vehicle and on a curb and all of a sudden we hear a pop. When we're playing a sport and do we have some pain here? Or any way that you have just an acute injury to the ankle. Nick, I'll direct this at you. We hear about sprains and torn ligaments and high ankle sprains. Walk us through here. When we say an ankle has been sprained, biomechanically, what has just happened inside that joint?
Well, usually it's an inversion injury where the ankle twists with the toes going towards the middle of your body. Those lateral ligaments, there's three of them. They can be sprained 1, 2, or 3, or ruptured all 3. So they grade them 1, 2, and 3. 3 is the worst, where all 3 ligaments are pretty much torn, bleeding, and swelling. The mild sprains usually get better quicker. The grade 3s, usually I put those guys in a cast for 2 weeks to let those ligaments get closer together so they don't become a chronic and unstable ankle.
Yeah.
And then you have your high ankle sprains, which are, they're another breed. They don't get better quick. They leave a lot of athletes on the sideline for 2-3 months. And that's a different ligament. That's the ligament that connects the 2 shin bones at the bottom at the top of the ankle. The syndesmotic ligament gets ruptured or torn. And that takes longer to heal.
Is it me, or did they just start calling high ankle sprains within the last 10, 12 years? Because growing up, we didn't hear high ankle sprain. We heard it was a bad sprain or it was right? When did high ankle come into play?
I guess the lay public, in the last 10, 15 years, because you see sports on television more often and you hear about it. I mean, I forget what football player was, one of the great receivers that ended up having his repaired because he ruptured so bad he had to fix it, and he ended up playing in the Super Bowl 6 weeks later. He had it fixed in Baltimore.
I don't remember who it was, but it was kind of a revolutionary take on doing the surgery.
Yeah, he ended up playing in San Francisco after that,
Exactly
he
right.
played for Baltimore at the time.
Is there one standard thing that we should do initially when we have an ankle sprain? Travis, what's the first thing someone should do?
So, the first thing right after a sprain is, we're trying to control pain and control swelling. We think of the acronym PRICE. So we want to protect it. That's P. R is for rest. I is for ice. C compression, and E for elevation. And those all things are just to control pain and swelling. And that's certainly the first 72 hours, but that can kind of even take over for a week or 2.
Okay, so when we ice, give me the number of minutes and what's the best way to do it if you're just doing it in home.
15 to 20 minutes is usually where we like to keep that. We don't like to go a ton over top of that. It depends on what you're using. If you're using a gel pack, make sure you cover that up with a towel or pillowcase. You don't want to get a chemical burn. If you're using, just regular ice cubes, those can go in a bag over top of the skin.
Nick, what's realistic to think if someone does not have a high ankle, and we'll get back to that in a second, but if someone has a standard, what you would call a mild sprain or a moderate sprain, what's realistic from the time it happens to the time that they can go about and be normal again?
Normal sports-wise?
Normal sports-wise.
Depends on the activity. If it's just running, I guess you could say they could get back within a couple of weeks. If it's a lateral type movement sport, football, basketball, they can try to do that at that point, but it'd be a lot of taping, a lot of splinting while they're doing it. So 2 to 4 weeks probably for a mild, 6 to 8 for a more general severe one.
Here comes a stupid question, and it won't be the last one I ask, but is there any way we can be more preventative about ankle sprains? Is there anything that folks can do?
I think from a sports standpoint, that's kind of where your off-season programs go, your preseason programs, and that's kind of the, making sure kind of the practicing jumping, even some of the plyometric exercises and those kind of things can kind of train the muscles to, control you and how to land properly. It's not a surefire thing, but I think that's the best thing. you can do. And we could also talk about bracing. Wearing
Sure.
prophylactic bracing that's an option that's out there. Might be interested to get Dr. Zervos' take on the bracing.
Well, I know the shoes don't matter.
Yeah.
It's not the shoe, unless you have just some bad shoe that's going to be prone to inverting you.
Right.
The high ankle braces they wrap with, you don't see that too often until a kid or an athlete has had that injury and says, I'm not doing that again. And I think they do help. They're prophylactic more so than the old high tops we wore. I think a lot of it in the way that sports is now, where kids are just training nonstop, it may lead to overuse, deconditioning.
Right.
Yeah, like a tired body. And then eventually you don't have the strength to withstand that turn that's coming on that last cut.
Basketball Mountaineers are always taping up before practices. How helpful is that? And should high school kids, should they have their ankles taped before practice, before a game?
It couldn't hurt at all. No. It'd be the same thing as that prophylactic brace, but it's less confining. So, yeah.
Mm-hmm. Yeah. Nick, when does an ankle sprain get to the point where surgery is needed? We mentioned the high ankle, or putting someone in a boot. When do you reach that decision? What's going on there, and you're factoring in, okay, this thing really needs to be left alone?
Oh, well, I guess for just an acute ankle sprain, if it's a new sprain, some major athletes, it's something they fix if it's a grade 3. Or if there's a concomitant injury to the deltoid, which is the medial ankle injury, those together will make something so sloppy loose.
Yeah.
So that would be like almost like a partial dislocation of an ankle. You'd want to be fixing ligaments to tighten them up so they don't come back to haunt you. And in the long term, that kid that sprains their ankle every day or every week and has to tape and everything, then in that situation, you're going to do a reconstruction of those ligaments because they're incompetent. And in reality, that prevents arthritis later, honestly.
You've also heard this, that sometimes you're better off suffering a fracture than you are a high ankle sprain. I got a half a smile out of you. Yes, no?
Depends on the fracture, I guess. There's some fractures that within 2 weeks people are normal. I had a partner who sprained his ankle on a walnut at 4 a.m. running and ran on it for 6 weeks and kept saying it hurt, and he got an x-ray and it was broken. He was that kind of tough guy. He ran on a broken ankle for 6 weeks. He just never stopped.
Right.
So,
whereas if that was a true high ankle, there was no way he would have ever been able to
he
move.
would have never. The swelling, the instability of those two bones at the bottom prevents you from putting that much force through it. Yeah.
Yeah. Foot and ankle problems are our discussion point here today on this edition of Ask the Experts. Dr. Nick Zervos, orthopedic surgeon, is with us, along with Travis Rummel, who is the clinical director at the Smithfield, Pennsylvania location of HealthWorks. And these two guys will be hosting a free seminar coming up on Thursday night, August the 29th, at HealthWorks Maple Drive location. It's 7 o'clock, and it's free, and it's open to the public. If you'd like more information, just give them a call at 599-2515, 599-2515. You do not need to reserve a spot, but if you've got questions about it, by all means, give them a call. We invite you to stay tuned. We'll wrap things up when we return here on WAG.